So someone asked me, if you are a diploma nurse, how can you apply for band 6 role? How can you be a supervisor or band 6 sister? So the answer to this question, we are going to discuss in this video each and everything about diploma nurses and what is the role of band 6 and whether they should apply for band 6 role or not. Can they get the job of band 6 nurse when they are diploma holders? If they are diploma holders, is it possible for them to get this job? So the answer to this question I'm going to discuss in this video. If you are interested in this topic, please watch the video till the end. This is Simon Adim. If you haven't met me before, I'm a nurse from Southeast England and I'm practicing here since 2020, and happy to have you here on board. And let's start the video without any further delay. So if you are a diploma nurse, means you have done your general nursing for 3 years and 1 year midwifery course, so or only general nursing for 3 years. That mean, and you got a diploma, you haven't done your BSc, you haven't done your bachelor's in nursing, or you haven't done any post-RN degree. That is the diploma nurse, right? Diploma nurse, only they have the diploma that they have completed 3 years or 4 years of nursing as an adult nurse or as pediatric nurse. Those are the nurses with the diplomas, right? So here in the NHS, when we come here to the UK, when we come over, we start as band 3 nurse, we pass our OSCE, then we become band 5 nurse. After getting the NMC pin, then we are called registered nurses or band 5 nurses, right? When you are in the trust for at least 1 year or 2 years and you have the necessary skills to work in your department, or you know how it works, if you are working in a general medical ward, or you are working in a surgical ward or in a ICU ward, and you know that you are good enough to handle the situation, you are good enough to take the lead, and a set number of people can work under you, you can lead them, you can provide, you have excellent leadership skills, you have excellent communication skills, and if there is any emergency, you can handle the situation, and you take all the things like same like as a manager, and you feel like you have the abilities to do that, and you are confident enough to take the lead on day-to-day basis. When you work as a nurse, you are a leader already in your team. I mean, if you get 10 patients as a band 5 nurse, you have a support worker with you, and if you have any other carer with you, but usually it's one nurse and one care support worker. So in that also, you are the leader of your team, and you are the manager of your team, and you are the one who takes decision for your team or for your patients, whether you need to call the doctor, whether you need to inform anything to your manager or to your matron. You are the person to do these tasks. The healthcare support workers, they are not responsible for that. So you as a nurse is the leader of the team or of the day, or a leader of your patients, or advocate of your patients. You can call it anything you like to call, but what I'm trying to say is you lead your team every day. All right, and when you get the necessary skills and knowledge and the training, and you feel like you are confident enough, you can work as a leader, you can work as a manager, I mean as a supervisor, you have done any supervisory course, and you feel like you can do it, you have the abilities, you have the qualities to work as a band 6, then you should apply for band 6 role. It doesn't matter if you have diploma only, it doesn't matter you are a BSN nurse or you have done MSc nursing. So if you are if you have done your MSc nursing, well and good, because it will give you more opportunities, it will enhance your chance to get that job. If I as diploma nurse applied for that job, and you as MSc nurse, you applied for that job as well, so between two of us, they will hire you, not me, right? But it depends on the candidates who applied for the job, and most of the times it depends also if you have experience in that particular ward. Let's say I'm working in my general medicine ward for almost 2 years, and then you have your MSc degree but you haven't worked in my department and you are new to the department, so the chances for getting that job would be mine. All right, does it make sense? So they give you more chances if you have the work experience in that particular ward. So if you are new to the department, it makes a bit difficult for you to get that job. So what I'm trying to say is MSc or BSc is a plus point and you can get job, but here in the UK qualification is not everything. If you proved yourself, you have shown good communication skills, good leadership skills, you have done necessary supervisory courses, and you can still get a job of band 6, and a band 6 we call it sister here, so you can still get a job of band 6 nurse in the UK even if you don't have MSc degree. So don't hesitate to apply. If any opportunity comes, you should apply for that, and don't think that I don't have the required qualification. It doesn't matter. Sometimes what they want is they want to see if you can. They give you a lot of scenarios in the interview. They ask you so many questions. They test your knowledge, they test your communication skills, they test your ability to handle the situation. And also when you go for the interview, they ask like 10-15 scenarios. They give you scenario and they want to see your answer. What will you do in that situation as a nurse or as a team leader? Or they also ask you questions like the manager is not there, what should you do in that situation? Or they also ask you questions like difficult patient or difficult situation, or manager is not available, or any other supervisor is not available, or we don't have staff, what should you do in those situations? So if you answer to those questions in the interview and you have a good reputation in your department, then there are more chances for you to get that job. I am not saying that in each organization they hire band 6 without MSc nursing, because sometimes some organization it is their priority. They hire nurses, band 5 nurses who have MSc, they hire them for band 6, but sometimes it is still possible that you can get a job of band 6 if you have diploma nurse. I am live example of a diploma nurse, but I am band 6 already, and I am only 2 years in my trust. But again, I have done professional nurse advocate training, and they give you 20 NMC points for that, and it is equivalent to managerial post. So it's totally up to you. If you have done so many supervisory courses, and the chances for you to get this job are higher. The chances for you to get that job is higher. So it's not a must that you should have MSc. I know it's a requirement when you apply for the NHS job. It is a requirement. They ask that do you have MSc degree, or you planning to have MSc degree? So you can write about that in your CV when you submit that application. You can write it in your application that I don't have MSc, but I'm planning to take, or whatever your circumstances are, you can write them down in the application. And the thing is, you need to prove yourself in your department. For me, I was working as band 6 already when I was band 5, so almost for 1.5 years I was only doing the job of band 6. Most of the times I would go for duty, and they'll assign me as a band 6. But the thing is, I never I'm not saying anything bad or something, but I never get paid for band 6. I was only getting money for band 5 role, but I was working as band 6 most of the times. My duty was to work as band 6. So 1.5 years I did work as a band 6 without the job title, without the job description or designation. So if I can get that job, the thing is, you need to prove yourself, you need to show good communication skill, you need to prove your leadership skills, and you need to take the lead. You need to prove that you can take the lead without managerial support, you can take the lead without matron support. But again, whether you are band 6 or band 7, you still need the support of the matrons, you still need the support of the managers. But in case they are not available, you should be able to handle the situation on their own. So that's it guys for today's video. I hope I clear some of your doubts, because a lot of people, they were asking, I'm a diploma nurse, so how come I am a band 6 already. So I think I've explained it in explained it well. If you still have any questions, let me know in the comment section. Oh, I forgot to mention, someone asked me that she is a ICU nurse, band 5 nurse, and she wants to do she wants to apply for band 6 role in her department. So I would advise you, yes, you can apply, and don't think that you don't have MSc or anything. It's fine. You still, if you have good experience in your department, if you have good reputation, if you have good leadership communication skills, if you have done loads of supervisory courses, you can still get that job. And of course your manager, she would know you better than anybody else. So if your manager, she knows you, and you know that you have the necessary skills and knowledge and competencies, then of course you should apply for that job, and hopefully you will get the job. So that's it guys for today's video. I hope you liked this video. If you did, please give it a big thumbs up. You can also share it with your friends and colleagues. I will see you soon in the next video. Till then, take care. Bye bye. You haven't subscribed, there is a red button on there, you can press on that one so you don't miss any notification. Press the bell icon also. I'll see you soon in the next video. Take care. Bye bye.